Welcome to our webinar with Harlem Health Initiatives, CUNY SPH, and our special guest, Marlene Taylor, physician assistant. Today's webinar will be about meeting with your PCP, primary care provider, and why you should make an appointment with your primary care provider this fall. All right, and thank you so much to Marlene Taylor, PA from Ryan Health. Marlene's a primary care provider with over 35 years of medical experience, dedicated to improving health outcomes in underserved communities. She's currently on the staff at Ryan Health Adair Clinic in Harlem. She provides comprehensive care for chronic conditions and preventative health with special expertise in HIV, hepatitis, and infectious disease. Marlene's cared for hundreds of patients over decades and is focused on long-term compassionate and equitable care. And she's really deeply committed to addressing health disparities in communities of color. She served as a board member of the Coalition of Positive Health Empowerment and is the co-founder of the Taylor Moses Institute for Health Professions, which mentors students pursuing healthcare careers to combat health inequities. She's earned numerous awards for all of her work, including the Black Nurses Association Community Service Award and the City of Mount Vernon STEM Award for Outstanding Women in Science. So we're very lucky to have you today, Marlene. Thank you so much for participating.
Thank you. It's an honor to be able to speak to the audience today about a very important topic. So thank you, the Harlem Health Initiative, for all the wonderful work you've done in the community. And although we've made strides over the last few decades, we still have a ways to go. And I know Harlem Health Initiative is pivotal to that challenge. So thank you for this.
Thank you so much. All right. So for a quick agenda, that was our introduction, and then we'll get right into our panelist discussion with Marlene and do some Q&A towards the end. All right, and today's discussion will cover what is a PCP, why should I go and see a PCP, what can a PCP help me with, and what preventative services can I get in my meeting with my primary care practitioner or physician. All right, Marlene, I will pass it over to you to take it from here.
Great, thank you so much. So what exactly is a PCP? I know many people have heard, the term and heard the, acronym, like what is a PCP? It's very important to understand it's a primary care provider. And that person is like your healthcare partner. They are your first stop for your comprehensive care. It basically is the first stop for addressing all of your healthcare needs. A PCP can be different types of healthcare professionals, either a physician, which is usually an MD or DO, a nurse practitioner who's an NP, or a physician assistant or associate, a PA. A medical professional who learns your history and goals and provides your long-term care. So basically, your PCP knows everything about you and your healthcare, so that they, in fact, and we'll speak in the next few slides about the other areas in medicine and surgery that have to do with your health. But primary care is very, very important because all of the information about you as a patient will help to determine how you manage your health. And we'll go into detail about those other specialties. But understanding that the primary care provider is in the center of your healthcare, and they should be the person you go to before going into any other questions about your healthcare. You should make sure that you feel comfortable with the PCP, because given that they know everything about you, or they should, if there's some areas that you may not feel comfortable talking about and you feel awkward or uncomfortable with the PCP, it's not really a good idea. You can choose, and you can actually get a second or third opinion you can shop around until you find someone who you feel comfortable speaking to about anything regarding your health. Next slide. So as I mentioned, the PCP is a person who you feel comfortable talking to. So why should I even have a PCP? A lot of, I think patients may think, well, I have a rash, I'm just going to go to a dermatologist. Or I have a gynecological issue, I'm just going to go to the gynecologist. However, getting the comprehensive history that might determine if in fact the PCP can treat that problem or decide on a specific subspecialist within the specialty area is key. So the PCP can kind of wean out like what is, for example, a priority, what is a specialty problem, what is something that should be done as a standard for care. So like in general, the way to think of a PCP is that before going to an emergency room or before going into an urgent care center, or even before going to a specialist, you should have run it by your PCP. Your PCP will ask questions in general about your health in detail. So one thing we do at an initial PCP visit is, of course, we find out what active problems are going on or what brought the patient to that visit, but we also ask a detailed past medical history. So if someone's ever had asthma or ever had pneumonia or ever had COVID or had specific types of surgery, that can impact the overall wellness of that patient. And the PCP's job is to put that all together and decide what treatment plan is necessary for that patient. They can help you treat and diagnose conditions. So there are many conditions that we treat without having to go to referring a patient to a specialist. For example, hypertension. If someone has hypertension or high blood pressure and they've been stable on a certain medication regimen, they may not have to go see a cardiologist or a kidney specialist who also handles hypertension. So the other thing that the PCP will do is monitor those lab tests that are necessary for addressing the active problem. So for example, with hypertension, your kidney function is key. And so we would get, and I get regularly, kidney function tests every 3 months. I may also get a urinalysis because that also shows if protein spills over into the urine, and that can be a sign of worsening of the hypertension. So there are many things that we do from a primary care standpoint before referring to a specialist. A PCP, one of the convenient things about a PCP is that you can always come to them and they know what your baseline is. So if you develop any symptoms or get sick, and we have the upcoming winter season and flu season coming up, you can get a flu shot. We would treat symptoms that may be allergies, seasonal allergies. We can treat so many different things that have to do with knowing the patient really well and knowing what's a significant change from their baseline. So I may be able to say that, you know how every year you get this bronchitis, so why don't we, get a chest x-ray if you start coughing. If someone doesn't know you and they're not your PCP, they may not do those other steps, which are necessary when you know the patient really well. So the PCP can see you when you feel sick. I have patients who actually, we have a work phone and they call me on the work cell phone and say, you know what, Ms. Taylor, I saw you a week ago, but I wasn't sniffling, or I sniffled and now it's turned into a cough. And I may be able to, just because I recently examined the patient, just call on a prescription. You don't necessarily get that, and you don't really get that from a provider who you don't know. But given that you know what the patient's baseline is, you can go ahead and, for convenience sake, and also for knowing the patient, go ahead and address medical problems without even having people go through the emergency room or urgent care. And as I mentioned, we can prescribe and refill your medications and give you your seasonal vaccines and immunizations. So for example, if I know that my patient developed a side effect from a specific type of vaccine, I have that information in their chart, but also knowing the patient and what that side effect may have looked like. When you go to a new provider, you may say things like, well, I can't take this or I can't take that. But knowing a patient over time, which is something that the PCP does, they can say and they can really understand the nuances associated with that patient and their medical history. Your PCP knows what health screenings you should get based on the things like your age, your gender, and your health history. And that pretty much summarizes what the point I was making. For example, my patients who are HIV positive, I know that there are specific guidelines for patients who are HIV positive, particularly with vaccinations. There's some things we give earlier, there's some things we give at a different dosage. And so it's important that knowing the history impacts what you're going to do with next steps. So a lot of pharmacies offer vaccines. And if a patient doesn't feel comfortable telling, for example, the pharmacist that they may be HIV positive or have a certain medical problem that might require a different dosage, the pharmacy just gives the dosages of these immunizations or vaccinations. But when you have a PCP, we can say, nope, you're not 65 yet. You might not need the shingles, or you may need it because we know that you developed certain other viral illnesses that may say or speak to the fact that you need vaccines earlier, later, or as I mentioned, at a different dosage, or maybe not be given at all. There's a lot of advertisements on television, of course, on social media, and of course, just flyers and banners throughout the streets of New York where we are. However, that might not be specific for you. One thing that your PCP can help with is saying, you know what, John or Mary, when you developed this illness last week, I don't want to give you, for example, that vaccine right now, or let's hold off on that, or let's wait for these labs to come back because we need to compare those labs to your previous labs. So a PCP is like your own person who knows you really well and actually makes things safer for you when it comes to all of the noise that we get from social media, from the internet, and just from advertisements. I'll give you an example. It's been said that you can give and that it is safe to give the COVID vaccine and the flu vaccine. However, I did have a patient once who got them both from an outside, I won't say the pharmacy, and she developed a severe illness. So now when she sees me, we know we definitely don't give those two vaccines together. I always say I'm not a fan of giving two viral immunizations at the same time, particularly because I have a number of patients who have immune systems which are compromised. And also I see a number of elderly patients who, even though they're HIV negative, they still have a suppressed immune system when you compare them to like my 20 and 30-year-olds. So there are things that your PCP is aware of, even based on just your lab tests. We may notice that they develop sinus infections more. And I'm not just going to give you a vaccine if you're in the midst of having an active upper respiratory infection. The pharmacist may not know to do that. So it's really, really important to know the whole patient before participating in a lot of things that are promoted, like, oh, you can get this for free, or you can get this, stop in and get this. It's like, no, you have to run it by your PCP because they know you best. Next slide. So what are some of the services that the PCP provides? And I mentioned a few of them, but let's dive deeper into what those things are. Your PCP can administer vaccines and regular healthcare screenings based on your age, your gender, and health history. So as I mentioned, there are things called guidelines, and guidelines are the standard of care for you based on your specific age, your gender, and your medical history. And they're experts who annually or every few years develop these guidelines. They're experts in specific fields. So for example, there's a diabetes, the American Diabetic Association has guidelines for what medication do you start patients on when they're newly diagnosed with diabetes? How do we manage pre-diabetes? So the guidelines give us that data and that information as primary care providers to move forward with. There are guidelines for HIV. For example, I remember a time being in the HIV specialty from the beginning of the epidemic. There was a time when we would wait to treat patients. The guidelines have changed over time, and now the standard of care is as soon as a patient is diagnosed with HIV disease, they're starting on medication right away, that same day. So a patient should never leave a clinic knowing they're positive without medication. So those are the HIV guidelines, as well as guidelines for urology. All men over 40 who in the African American race, I'll use ethnicity, for example. There are higher rates of prostate cancer and colon cancer in African Americans. So the screening guidelines for them have lowered. There used to be 50, now it's 45. In some patients, for example, with breast cancer, those guidelines have changed. So one of the things that a PCP is really good at is we know what the guidelines are for primary care. So let's talk about pap smears. So, for example, the specifics around who should have a pap smear, which is basically the test for screening for cervical cancer. What about, as I mentioned, STI screening? Sexually active adolescents and adults should be screened for gonorrhea, chlamydia, syphilis, and HIV. Those are the standard STDs, right, or STIs. Herpes is pretty much a diagnosis, a clinical diagnosis. So if you see lesions that are consistent with the way that herpes 2 presents, which is the sexually transmitted form of herpes, that can be made on the spot. You don't need to confirm that with a test. The cholesterol testing. So we've come really far with managing what we call the comorbid conditions associated with preventing heart disease. And so cholesterol, a hemoglobin A1C for prediabetes, hypertension, those are key to make sure that they're under control, because the goal of those problems is to prevent end-stage disease or end-stage events like heart attacks, strokes, and end-stage kidney disease, which is when patients are on dialysis. So we're not just interested in the numbers and telling the patients what the numbers are, but you want to be able to give the patient the understanding that we're trying to prevent progression of these diseases, because we don't want you in your 40s, 50s, 60s, or older to have a stroke or heart attack or be on dialysis. So as a primary care provider, at each visit, we're looking at what the blood pressure reading is. So it's so important that when we get labs back, for example, the cholesterol, that the patient has fasted the night before, so that we're getting an accurate depiction of what that lipid panel looks like. Because what we do is compare over time the trends. So we have a nice thing on our electronic medical record that allows us to do a cumulative snapshot of what not only the current labs are, but it compares the labs to your 3 months ago, 6 months ago, and even 2 and 3 years ago. So that patients leave the office knowing not only what the number is, but how they're doing compared to how they were doing a year ago, 6 months ago, 5 years ago. So important. I have many patients who have been with me for the last 15, 20, even 25 years. And I'm able to compare those labs because we have them scanned to our primary care chart. And we can say, you know what, in 2010, your cholesterol, your bad cholesterol was never borderline. So maybe we need to do some other things. But now it's starting to creep up to that area. So very, very, very important to have that history. Patients over 40, as I mentioned, in terms of the screenings that are indicated by the guidelines and can be changed over time. So 10 years ago, as I mentioned, mammogram screening was not at age 40. It was 45. The colonoscopy screening is important as a screening method for colon cancer. But we have other modalities that if a patient just offhand seeing someone that they don't really feel comfortable with, just for some of my patients, just hearing colonoscopy, they're like, no, I don't want to have that done. But they may not be open to the other options for colon cancer screening. For example, this new, actually, I have one in my drawer. It's called Cologuard. So Cologuard is a way to actually screen from colon cancer for colon cancer. And you actually have this box that you can leave the clinic with. And the box actually is a stool sample, but it actually has a high rate of specificity and accuracy when it comes to colon cancer screening. So what I'll do is I'll pull up on the internet this little video that goes over how it's done. Patients who are not comfortable with a specific provider may not even want to go further than just saying, no, I never had that done and I don't want to have it done anymore. I don't want to have it done at all. Explaining the difference between prostate cancer and colon cancer is something that I'm constantly faced with patients who don't really, they just know you have the rectum and they know it is associated with going in and doing an exam, which is part of the primary care exam. But what are we doing throughout that exam? We're actually palpating the prostate gland, but it also is the end of the colon. So they think getting a colonoscopy has to do with prostate screening and vice versa. So a lot of education takes place when you even mention screenings. It's not like you just say, okay, your colonoscopy or a prostate blood test called a PSA. Going into detail, and that sort of takes time away from what time we're given for a primary care visit. So many times I may use several visits to get patients to agree to screenings or even have an understanding of what that screening entails. So the initial visit might be your history, your physical, and then ordering lab tests. But we may not even get around to ordering those special screening tests until the third or fourth or even more visits down the line, because just them coming in for their primary care exam is a lot for them. And just them understanding what the lab tests have shown is a lot for them to accept and work through. So getting to these very, very important screenings is another challenge for many patients. Lung cancer screening, we now have a CAT scan that has become standard for screening for lung cancer and bone disease as well. When you get something called a DEXA scan, the guidelines for getting that change. And the DEXA scan basically tells us if men and women have evidence of bone disease that includes but not limited to osteoporosis, osteopenia, which is like weakening of the bones. Brittle bones is osteomalacia, is like softening of the bones. So osteoporosis, osteomalacia, and osteopenia are diseases that are picked up by getting a bone scan or a DEXA scan. Very different than another type of bone inflammation, which is arthritis. So arthritis, there are different types of arthritis. Osteoarthritis, which can happen with age, with time, or after trauma to a joint or bone, you can develop arthritis from that. And then there are other etiologies of arthritis, rheumatoid arthritis. So there's a lot of education and teaching that goes into place when you are speaking to patients about screening. Some things are pretty straightforward. Breast cancer, we're going to do a mammogram. But what if women have dense breasts or have painful breasts and they're afraid to go for a mammogram? We may be able to offer them an ultrasound or talk about other modalities and approaches to screening for breast cancer. But education is key. And I do a lot of that as a primary care provider. Having just come off of October Breast Cancer Awareness Month, I was involved with 3 different educational initiatives in the community that really go into detail about how we detect and how we screen for breast cancer. Because there's a lot of myths and a lot of fear and a lot of hesitancy around approaching screening for diseases. We know historically in this country, people of color have not been always treated correctly, rightly so. The Tuskegee study and other things that have happened really have caused patients to pause and say, I don't trust healthcare providers. So it's very important that one, acknowledging that fact, but also educating them about what the outcomes are, because we know with the disparities that we see particularly in communities of color with African Americans and Latino patients, the outcomes are worse. One thing I'll mention as a breast cancer ambassador for the American Cancer Society is that we have an active study called Voices, and I'll show you in my office. This study is basically trying to recruit over 100,000 women, Black women, to see why is it that their outcomes when they are diagnosed worse, why is the type of cancer they have the more aggressive form, and why do we still have challenges when it comes to, and specifically African American women getting screened and really being followed over time. So this study, let's see if we can get this. And I can leave some information at the end of the presentation, but basically it's a new way to really try to get women of color engaged in the studies, because if we don't have participation, we can't tell what the outcomes will be. And historically, African Americans are not involved in a lot of the trials, the clinical trials, so that we can see how they would perform and what their the safety and efficacy, specifically, even when it comes to medications, what they would have or not have, and when we talk about all the adverse effects. So it's important that in this specific example, when it comes to breast cancer outcomes. And what about vaccines? Again, depending on the age, depending on the patient's medical history, the flu vaccine, we have a high dose flu vaccine that we use for the over 65. So again, your PCP knowing that maybe you're following them for a while, and lo and behold, their 65th birthday, now they get the high dose flu shot. Specifically the COVID vaccine, there's some people who have had allergic reactions or different side effects. So knowing what they've been on before, if they've taken Moderna or Pfizer, it's key and very important to know, again, from a primary care standpoint. And also the shingles vaccine. It targets a specific age group. So the PCP knowing that patient over time is important to know when it's time to do that specific vaccine. So getting regular screenings and vaccines can help prevent disease and manage health risks. Many times patients just show up to, for example, an urgent care and think, okay, I just need that, I just need that vaccine. And as I reiterated and continue to stress, knowing that patient and what has happened with them, but also following the guidelines and knowing what might be necessary for that individual patient. It's someone who knows your body really well and what you would do best with getting. Next slide. So what services can my PCP provide? As I mentioned, primary care is the gold standard. It's getting your medical history, doing a physical exam, and then getting the proper labs for you throughout the year. So they're the initial labs that are done once a year, being screened for tuberculosis. So we no longer use the skin tests. We do a blood test called a quantiferon that should be done once a year. We can be exposed, TB is airborne, and anyone can be exposed to TB and not know it. It can lie dormant in patients, and that's why we follow through with the skin test. And then if it does show that they've been exposed, we would get a chest x-ray next. We also do thyroid stimulating hormone. People can have subclinical thyroid disease, either hyperthyroidism or hypothyroidism, and not even know it. They may just feel sluggish or tired or think they're losing weight because they tried the latest fad diet, but they could in fact have thyroid disease. So getting that screening once a year is key. In addition to, of course, your liver and kidney function, your test for anemia, your test for cholesterol, and getting a urinalysis, which can tell us a lot. So I always explain to patients who are a little hesitant about the urinalysis, they may think we're getting a urine for drug screening because they still feel awkward about maybe smoking marijuana. So they'll say things like, oh, I can't pee now. And I'm like, I'm getting it to look at if there is glucose in the urine, if there's blood in the urine, if there is bacteria in the urine. So not necessarily an STD, not an STD, but kidney disease very early on can show up by spilling over into the urine protein. So diabetes that's uncontrolled before we get the glucose test back can spill over into the urine. Bacteria in the elderly, bacteria in the urine in an elderly person is one of the common tests that we get to confirm that there's a UTI in an elderly. They have a change in mental status, and a common cause is a UTI. As soon as you start them on the antibiotics and fluids, they clear up just like that. So getting a urinalysis is key. And there are several other tests that are done once a year as part of the primary care of a PCP. Based on those tests, we know what to continue to follow throughout the year. So just getting that one initial or annual lab is important, but it's important to follow up. So not just coming in once, because if we say your cholesterol's high, for example, and we start you on meds, we want to see, well, not only how you tolerate the medication, but if it's doing, in fact, what we would hope it would do. There's 4 different types of fats, right? The lipids, and the lipid panel, the good, the bad, the triglycerides, and the total. And following those numbers, not just leaving saying, well, my cholesterol was good. Maybe the triglycerides were high and we put you on omega, which you can get omega or, Lovasa, which is, one of the fatty components. So omega-3 fatty acids are given to help address triglyceridemia. So there's specific things that we find out at that initial visit, which is key. And coming in the fall is also an excellent time to get the flu vaccine because you're getting protected from what's going to come down the line in the winter. So getting those flu vaccine and COVID vaccines or boosters in October and November is key because a couple of months down the line and your body will be equipped to deal with if you were exposed to someone on the subway, for example, who sneezes, and has the flu, guess what? You're going to be protected. Or someone who has COVID, who you're sitting next to and don't know it. If they sneeze, or even if they touch their nose, because remember, it's absorbed through the mucosa. If they touch their nose, they don't have a mask on, and they touch the pole. We did vigilant during the height of COVID with gloves and masks and scarves and everything. But I think we've become a little complacent, and not to say that there's going to be another pandemic or epidemic, but it's still there. It's still out there. And I've diagnosed it even way past the pandemic in 2024 and 2025. So we have to be as vigilant with what we know and what we now have in our toolbox of protection. In addition, of course, to wearing your mask and washing your hands regularly. So your PCP can refer you to those specialists. Diabetics, for example, once a year should see an ophthalmologist, not the optician to get the new glasses, but an ophthalmologist. There are various disease states that cause changes in the back of the eye that have to do with having that disease. So a patient with diabetes and hypertension should see, and a patient who's HIV positive, it's very important that they see the ophthalmologist, because they can determine and see with the machine called a slit lamp what is going on with the patient and their disease state. Syphilis can be picked up in the back of the eyes. Toxoplasmosis, which is a parasitic infection, can be seen in the back of the eye. So very important to get an eye exam, not just for those new trendy glasses, which I actually got some and they look horrible. But anyway, not just for the new trendy glasses, but for determining any complications of a primary care disease that was diagnosed by your PCP. Seeing the dentist, there are various things that can be found, even though I look with my ophthalmoscope and my otoscope there, and I look in the mouth, but there are things that I can tell. For example, being on certain medications can cause gingivitis, can cause inflammation of the gums, and that in fact needs to be handled by the dentist, and he can in fact refer them to perhaps an oral surgeon if indicated. I've actually picked up Kaposi sarcoma in the mouth, which is a type of cancer that's associated with HIV. And this was in a patient who was not even HIV tested yet, because they had refused to get an HIV test. But looking in the mouth and seeing a lesion, a raised purplish tender lesion in the back of the oral pharynx or the back of the mouth, I was able to diagnose that. So getting a detailed oral exam by your primary care, but then referring them to the dentist is key. And a biopsy was done and confirmed that that was Kaposi sarcoma. Behavioral health services, about 30% of patients who are HIV positive have a mental illness or behavioral health problem. And in the general population, the numbers are increasing for several reasons. But one of the things that is done in a primary care visit is something called a PHQ-2 and 9. And basically it screens for simple things that people may not think about, but they are things that, as a provider, it lets us know that this patient needs to be referred to a mental health specialist. So things like sleeping, eating, feeling like hopeless. There's some things that are done during that screening that are pivotal to a psychiatric diagnosis. And we know in the current, now more than ever, we're challenged with food insecurities and healthcare and so many challenges, and we call them the social determinants of health. So some people can't even make it to a provider's appointment and they're sitting home depressed. So paying attention to when they finally do get there, what are those things that we can help with? And having a comprehensive clinic where you have someone who can help address not only the mental health, but also maybe tell them about the food pantry or tell them about where they can go to have an insurance, signing up for insurance. Here at Ryan, it's a federally qualified health center. So our motto is healthcare is a right, not a privilege. And we don't turn anyone away. And even if you don't have insurance, we have on site several days during the week a person who can help with signing up for insurance. For those who are not eligible, there's sliding scale and so many other ways that we can help get you the care that you need. But some patients are just so overwhelmed, they don't even make it out of the house. And when they finally do, it's important that we offer them the specific services that they need. Sometimes they may not even need to hear about the dentist, the ophthalmologist, or getting STD screening, but just being able to know that they found a place that they can come to where they can return and follow through for each one of these, in many cases, challenging problems. And, as I mentioned in the last bullet, health-related needs like transportation and food. So it's key. We have several groups in the clinics here at Ryan. We have several sites, one on the Lower East Side, the Harlem Nina or Ryan Nina. We have two in Harlem, Adair and Frederick Douglass. We have one on the in what we call Wadsworth, which is Upper Manhattan near Columbia. And then we have one on 97th Street, and then one in the Chelsea area on 44th Street called Ryan Chelsea. So we're throughout the city, but most importantly, having those services at those sites. And even if they're not at one specific site, we can refer you to another Ryan Center. For example, we have a women and children site that just sees women and children. So there's a lot that goes on. And we try to make sure that we acknowledge meeting the patient where they are when they come through the door, because getting primary care includes all of these things. And sometimes it takes time to address each one. So we have to triage what's the most urgent and then address that. And then over time, seeing that patient to hopefully address all of their needs. Next slide. So how can I find a PCP? So feeling comfortable with the person is important. It's not like one size fits all. I have a certain style and approach that may not work for some patients. For some, they're okay with, let's take time, let's go through things. Other people may just want to get in and get out. I need my physical. I need this form filled out. I'm in and I'm out. So talking to friends, of course, we have social media now. So looking at reviews, talking to your neighbors and friends and really saying, what about where you go? Or do you have anything that you want to mention about your provider that you think would be a good fit for me? Sometimes the newest fanciest places are not always the best for that specific patient. Many times people might see, a new clinic opened up and I'm going to go there. But the providers may not be seasoned in the area that patient needs. So again, asking around to relatives, friends, and neighbors, going on the internet, doing your homework about first knowing you and what's going on with you, and then finding the best fit. And not just always going with the first person that you meet. You don't have to. There's so many providers out there that I think it's, important to find that person that you connect with and feel comfortable talking about anything. Calling the insurance. Sometimes the insurance carriers they actually do have what they call member services or navigators. And they may be familiar with, most of the patients with, rheumatoid arthritis see this primary care provider. Most of the patients who are HIV positive see this provider. Or most of the patients who see the elderly see this provider. So utilizing your insurance, not only for it to be used to pay for your visit, but they have so many other services within these insurances. Many of them like Health First, Metro Plus, so many. They have people that participate in health fairs. And of course, they want people to sign up for their insurance, but you want to do your homework about, do they have the specialists who are going to address my needs? you may want to know how many people, and one of the things you want to ask your primary care provider, how many people like me who look like me? So if you're a 26-year-old female with issues with weight, who has Sjogren's, who is anemic, how many people like me have you taken care of? If they say none, then you may want to say, okay, let me continue to look around. You don't have to go with the newest place, or a place that's even if it's been around for years. You want to target the provider, the primary care provider, which is what we're talking about today. Searching online for a PCP near your home might be fine, but I do have patients who live, for example, in New Jersey, and a few who live in Queens, and a few who live in Brooklyn, and here I am in Harlem. But those are patients who I've known for years, who feel comfortable with me, and for whatever reason, don't want to find a place near their home. But for some people, that's important. I had a new patient last week who said he lives up the block. His doctor retired, and he came to come to Ryan. Now, my first few minutes with him were not ideal, but by the time he left, he was happy. But his first thing was, I waited a half an hour, and I explained to him why. Not that it was an excuse, but just that if you're the first patient, you get seen on time. If you're the last one, you get seen on time. And I try to stick to their times. But if something comes up with a patient who's the second, third, fourth, or fifth, that's an emergency, I can't rush and get the other patient. I have to address that urgent issue. And I do take my time. So patients knowing that that's my style, and he was okay with that because he had a number of things that I specialize in. He was okay with that. But there's some patients who want to get in and get out. And they're like, I don't see too many of them, but for the most part, they want someone who listens, someone who knows them, someone who will remember them, and that they have access to. So listed on this slide are various clinics where their primary care service is provided. As I keep mentioning, where I am, Ryan, not to put a plug in for us, but I am very honored to work for an organization whose mission is healthcare is a right, because some people just don't realize that, and that they don't turn anyone away. So many people are used to being, oh, they don't take my insurance, or that someplace doesn't, they don't take my insurance. There's so many things that Ryan provides. So that's Ryan Health, and the website, ryanhealth.org. Harlem Hospital has several satellite clinics throughout the city, but mostly in Harlem. Sun River Health is another site, and Mount Sinai has a number of clinics throughout Manhattan. Health and Hospitals Corporation means the city hospital. So even if people don't have insurance, they're definitely never turned away from a health and hospitals center. Gotham, I think, is one of them as well. The hospitals in New York are Bellevue, Harlem Hospital, Metropolitan, who we also partner with. So Ryan partners with several hospitals throughout the city. The Harlem site is near Harlem Hospital and Metropolitan, but we also partner with Mount Sinai. So it's really important to know. So if you ever have to be admitted, we're your primary care provider. Are they affiliated with various hospitals that you may have a record at? Next slide. So another resource that you can use to search for a PCP is using the New York State Provider and Health Plan Lookup Tool. So they list all of the providers who are in New York and what their specialty areas are. So you'll see me in there with not only primary medical care, but HIV, hepatitis C, substance abuse, and so I also see, women with gynecological issues as well. But a primary care provider can also specialize in various areas, but reading the reviews and just finding if you're comfortable with them. You can also contact the Harlem Health Initiatives team via email at harlemhealth@sph.cuny.edu. And then, as I mentioned, my Ryan website, ryanhealth.org. I thank you all for listening. If you have any questions, you can reach me at the Ryan Health. You can ask by emailing the Ryan website. I'm at the Harlem Web Clinic, at the Harlem Adair Clinic, which is 565 Manhattan Avenue. And yeah, get your PCP visit in. Feel comfortable with them. There's a lot of information that we get, which is very important for your overall health over time. And good luck. Take care.